Hi everyone, my name is Gaurav Kumar and currently I am pursuing Masters in Public Health in Health Economics and Finance. So today I am going to discuss about how healthcare systems actually work and why they often don't. So when we think about healthcare, we usually think that it is a system run by the government, but that is not true. Healthcare system is often or usually what we assume about this is completely out of context. So what I want to tell you that healthcare system is not a single unified entity, but it is a complex system in which multiple stakeholders are involved and with competing mindset. So when you think that healthcare system is only for the welfare, that is not true. Nowadays it has been completely commercialized, and this is a new emerging market. So when we think about healthcare, we think that healthcare is supposed to save lives, but somehow across countries it also manages to be expensive, inefficient, and unequal, sometimes all at once. So, what's going on here? Why does a system designed for health often fail to deliver it? In this video, I will break healthcare systems into three components. First one is financing, means who pays for these services. These services. Second one is provision, who are providing or who are delivering healthcare services. And third one is regulation, who controls the system. And the key idea is very simple. Healthcare outcomes depend less on how much you spend and how these and more on how these three parts interact. So I'm going to start with the first section, that is financing. There are three main ways healthcare is funded. First one is government funded system, which is tax based. Second one is insurance based system, and third one is out of pocket payments. Now take India for as an example. A large share of healthcare spending still comes directly from households, and this creates a major issue. And first one is financial risk. People often delay treatment, fall into poverty, or avoid healthcare altogether because they simply can't afford it. Schemes like Pradhan Mantri Jan Arogya Yojana try to reduce this burden, but coverage gaps and implementation issues remain. So financing isn't just about money; it's about who bears the risk of getting sick. Now next section is provision. Who actually delivers, who actually provides healthcare? And this can be public hospitals, private hospitals, NGO, non-profit organization. So when we go for any healthcare in the healthcare market, we usually visit either public hospitals, private hospitals, or few services are provided by the NGOs. So we usually visit according to our capacity to pay. If we are belonging to um, high per capita expenditure group, then we visit generally private hospital. If we are middle class and we belong to low per capita expenditure group, then we visit generally public hospitals. And uh, society or people who are belonging to BPL families, they generally take help of NGOs or free services. So in many countries, especially India, the private sector dominates service delivery. As we all know that when we visit the public hospitals, we see that which type of facility or which type of healthcare services they are providing us. So most of the people even they they are not able to afford that private services. In spite of that, they visit private hospitals because they know that if we go in public health hospital or public hospital, there is no services, no facilities, no healthcare workers, and even people usually die there. That's why they prefer to visit private hospital, even they have to pay too much money, or they have to face catastrophic expenditure. So this sounds efficient, more providers, more options, but it comes with problems. Profit driven care, more treatment or unnecessary diagnostics, huge variation in quality. This is where a concept called information asymmetry comes in. Patients don't know as much as doctors, so they rely on them completely, and this imbalance can easily be exploited. So, while provision increases availability, it does not guarantee appropriate or equitable care. Third section is regulation. So, and if we think, then regulation is most overlooked thing in the public in the healthcare systems. So governments are supposed to set the standards, set the rules and regulation, control the market prices, and ensure quality of the services. But in reality, we all know that our all these things are often weak or inconsistent as per the standard norms. This lead to this leads to price variation for the same treatment, lack of accountability, uneven quality across providers. For example, two hospitals in the same city can charge completely different amounts for the same procedure with no clear justification. So we usually face this, that in same locality, in same city, we visit two hospitals for the same services, and we have to pay different amount for that services. And who is responsible for this? I think the authority who is responsible for regulating all these things are responsible, because in government, or in health ministry, or in our constitution right to health, there is a rule of regulation. There is a rule which is made only for regulation, and all these regulations have been made big or by, or there is some pathways have been has been I think what we can say, that they have find some way to pass all these regulations. And we usually hear that people are dying, children are dying after after using that syrup, or after taking that medication, or due because of overdoses. Because why all these things are happening? Because there is no regulation, there is no accountability from the government side. So without a strong regulation, healthcare systems become fragmented and unpredictable. When these three components don't align, systems fail. If financing is weak, people can't access care. If provision is profit driven, care becomes inefficient. If regulation is weak, quality and equity differ. This creates a system that treats illness but does not necessarily improve health. So the next time someone says we need more hospitals or more funding, remember, healthcare is not just about building infrastructure and more hospitals, but it's about designing systems. Because ultimately, the real question is, are we creating healthcare systems that serve people, or systems that people have to struggle to survive within? So, if we want to conclude today's video, the conclusion is that we are spending money, we are providing systems, but are these systems are able to save lives? We have to think about this, and you should think about this. Thank you.